my pleasure to talk to you on antioxidants for female infertility, whether it works or does not work. This will be the content flow that I will talk about the oxidative stress, the ROS and antioxidant paradox, and then I will talk about antioxidant, how do they work, various antioxidants, how they are used in fertility practice, and the Cochrane results. Now, antioxidants have flooded the market, but the market is mostly unregulated. Significant number of doctors use it in the hope that the patients who are taking antioxidants in expectation that this will improve their chances of conception. And lately, many doctors are prescribing expensive antioxidants, and every day something new is added, which ordinary gynecologists have no clue. Einstein well said, if you cannot explain it in a very simple words, it means you do not understand it well enough. And it's a fact that the infertility experts do not have any in-depth knowledge as far as the antioxidants are concerned. Now, what is the evidence? There's a limited evidence. The trials show inconclusive results. It's important to establish antioxidants' utility in female infertility, whether or not the therapy improves fertility outcome in terms of clinical pregnancy rate and live birth rate, what are the harms of antioxidants, and antioxidants in IVF, whether they are becoming a part of the protocol. The impact of oxidative stress in female infertility and reproductive outcome is devastating. You name a condition which causes infertility, you find that an oxidative stress is behind it. This slide shows same thing again. There's an increasing evidence to show that the oxidative stress affects both natural and assisted fertility. We also know that every cell has an energy cycle. And in this energy cycle, few free radicals are generated. In low quantity, they are needed, very much needed. But once the levels go beyond the accepted, then it causes diseases and disorders. You can see here the free radicals in larger amounts cause diseases, and antioxidants are used for a disease prevention. Again, we find that as far as our body is concerned, reactive oxygen species and endogenous antioxidants are contained in a balanced level throughout the body. And this homeostasis prevents the oxidative stress. What are these antioxidants? Biologically and chemical compounds. They reduce oxidative damage caused by reactive oxygen species. And I will talk about it that once these free radicals are formed, they lose one of the electron. They're usually in pair, and these things attack the healthy cells to get this. The antioxidants give this electron to these free radicals and convert into harmless configuration. Avoiding damaging chain reaction, which can involve lipid, protein enzymes, carbohydrate, DNA, cell, and a nuclear membrane, up to cell death, can be caused all by these free radicals. So this is the slide which can definitely say that in this energy process, the reactant oxygen species are formed. They lose one of the electron. Once they lose one of the electron, they become almost a robber. And for them, this ROS is harmful to the normal cells. They attack the normal cells, affect every cell component, the mitochondria, the DNA, the cell wall, and all the metabolism related to proteins, lipids, and various enzymes. And then you find once these antioxidants come into play, they donate one electron to them, and then this effect of ROS disappears. You can see again the free radicals are unpaired electron. They only have one electron, and once they use this electron, you can see the oxidative stress effect and how the cell is damaged because of this free radicals. An antioxidant supplies an electron to these free radicals, and you find that they become harmless. So, as we know that the right combination of water, soil, sunlight, and nourishment is required to bring back the plant into life. In the similar way, antioxidants there's a premise that they will bring back the fertility. And you can see here that once one gives an antioxidant which nullifies all the free radicals, there is a pregnancy conducive atmosphere is produced, type 2 kind of an atmosphere, which we talk in recurrent abortions. And these prevent the cell and the DNA damage and whole lot of metabolism which is taking place. As a result, is the theoretical this thing that antioxidants prevent all this. We all know that there's a primary natural antioxidants which the body produces itself, and there are synthetic ones which we take as a dietary supplement. The endogenous antioxidants can knock 4 free radicals by one, while the synthetic ones which we take, one antioxidant radical can detoxify another, only one free radical. You can see here that antioxidants basically have a protective effect. Primary antioxidants are naturally produced in the body, and the secondary antioxidants are taken as a food supplements. You can see here that a whole lot of antioxidants are there in the market, and the new antioxidants are added almost every day. The antioxidants which are endogenously formed, you can find that they are there in the ovarian follicles, in the follicular, tubal, and peritoneal fluid. They're also there in the endometrial epithelium. And the gynecologists are desperate to use antioxidants because they have to make patient pregnant. And this happens in polycystic ovarian disease, where 70% of them find that they cannot get pregnant, and age-related infertility, because these days everybody starts thinking about pregnancy very late in their life. And we find that we Indians have a poor ovarian reserve. We have this decreased reserve 5 years earlier than our Western counterpart. And this number is not small. In IVF centers, it's around 35%. And poor IVF outcome is also seen left and right in our clinics, which is again close to 1/3. As for the treatment strategies using antioxidants are concerned, we can use it alone to attempt to improve fertility in infertility cases. We can use several months prior to ART to minimize endogenous sources of free radicals, or we can use simultaneously with ART in IVF as in supplements during ART protocols, and we presume that they minimize exogenous sources of free radicals. These are the antioxidants. I've listed few, which can be used as alone or as a combined antioxidants. I've been preparing this presentation for almost 2 years, and I had no clue which way things are going. We all know this antioxidants. I've just now mentioned that they neutralize free radicals by preventing its propagative oxidative chain reaction and scavenging existing free radicals. Merits of a few antioxidants which we use daily without knowing its evidence, किसी ने बता दिया और हम इस्तेमाल करने लगे. और यहाँ पर किसी में ने बताने की बात है. I think India is a very peculiar country where majority of the ART consultants don't want to share the name of anything what they're using. क्या HCG की preparation use करते हैं, क्या HMG की preparation use करते हैं. There are very few people like Brigadier Sharma who's magnanimous and trains hundreds and hundreds of people. Otherwise people आप एक पूछेंगे तो वो एक छोटी सी गली से निकल जाते हैं. Now, vitamin E is a level A categorization. It definitely improves in epithelial growth in blood vessels and in the endometrium, and they definitely protect the eggs and the sperms by the oxidative stress. And supplementation might be recommended whenever there is a deficiency, but we find that it is definitely used at least for male patients of ours. Vitamin D, again, you can find there's insufficient evidence, though it has been used in polycystic ovarian disease. Myo-inositol has not again shown its merit, and that's why it has not come into guidelines. I normally say that anything which comes in the guidelines need to be accepted. Otherwise, rest is junk. Vitamin C is again level C categorization. Lycopene, again, its role in fertility is less clear and more research is needed. As far as polycystic ovarian disease is the only condition which gets benefited the most by use of antioxidants. And I mentioned about it that PCOS, 70% of PCOS patients find that they are not been able to conceive and they take medical help. And here a whole lot of cytokinins are there which create a type 1 kind of a milieu, and that is pregnancy disaster, or it does not allow pregnancy to take place. Now, how antioxidants help in PCOD? Vitamin E is used, and it is supposed to improve the epithelial growth in blood vessels and the endometrium. Vitamin D is also, used by majority, benefit to women with PCOS in lowering hypoandrogenism. Then myo-inositol is again questionable. L-arginine, I find, and it has become a part of the IVF protocols, and everybody uses it. As far as N-acetylcysteine is concerned, it is needed for fertile cervical mucus and ovulation. And as for the diet advice is concerned, we advise our patients to use nuts and seeds, which are great source of polyunsaturated fatty acids, required both by the sperms and the ova. NAC in PCOS helps in improving the chances of ovulation to the tune of 6 times, the pregnancy rate to the tune of 3.5 times, and a live birth rate 3 times. This has been quoted in Frontiers of Medicine. Again, coenzyme Q10 has been recently got a lot of application, and one can find that this can not only is used as an antioxidant, it improves the mitochondrial function enhancement, it improves the immune system regulation, it causes anti-apoptosis and autophagy. Again, it is a good quote is there in Frontiers of Endocrinology 22. Now, we find that both in poor ovarian reserve and in polycystic ovarian disease, the patients who have been given supplementation with CoQ10 supplementation found that the pregnancy rate increases by almost 2-fold in both these conditions. Now, as for the DHA is concerned, it is supplementation is on the premise that it will improve the ovarian function and the fertility outcome in a diminished ovarian reserve. It is often recommended for women with low ovarian reserve before IVF, and quite a few of us are using it. DHA should be taken under medical supervision due to potential side effects, and the side effects are written so minutely that unless a person really studies them in detail, probably will not know about these side effects. L-arginine I just now mentioned, PUFA also I just now mentioned. Astaxanthin is 600 times more potent antioxidant than vitamin C. Melatonin gets a praise these days that it improves fertilization rate and implantation of embryo, and it is definitely gives a good sleep and takes away the anxiety of these infertile patients. Melatonin, it not only supports in the ART cycle, it neutralizes ovarian aging and supports embryo development. Again, good mention. It is seen that the fertilization rate increases from 20% to 50% with increase of almost 30%, and the pregnancy rate increases from 10% to 20%, again giving increase of almost 10% margin. Melatonin is given in the dose of 3 milligram, and many RCTs are available in favor of use of melatonin to increase clinical pregnancy rate. And however, the adequacy of the data is still poor and should not be yet recommended for a routine use. Now, coming to the review of literature, whether the antioxidants improve fertility, age-related infertility cases, infertility related to polycystic ovarian disease, whether they can optimize the results of ART cycles, and what is its role in premature ovarian failure, insufficiency, and what's their role in recurrent IVF failure. It's crucial to emphasize that these supplements should be given by the specialist. They can assess your individual needs, conduct tests, and recommend specific supplements if they believe that they may be benefiting you. Additionally, the effectiveness of these supplements can depend on various factors, including the underlying cause of infertility, overall health, age of the patient, and lifestyle factors. What works for one patient may not work the same way for another patient. This must be remembered. While there is some evidence to suggest that few of the antioxidants may have a potential benefit for fertility, their use should be tailored to individual needs and monitored by the medical professional. The fertility treatment and supplementation should be approached with a personalized and evidence-based strategy. When it comes to evidence, the Cochrane is on the top and the rest of the things follows in that descending order. Now, coming to the Cochrane review, the drug house lately have been promoting combined supplements which are very expensive. They may have CoQ10, DHA, vitamin E, lycopene. It's important to note that while some studies suggest potential benefits, few results are mixed and not all women may experience the same outcome. Now, as far as individual antioxidants are concerned, pentoxifylline is supposed to have some evidence, and it is used in the dose of 400 milligram twice a day. In my own practice, I have not seen Dr. Parihar had been with me. He was fond of giving pentoxifylline, but we have not used it lately for the last 10 years. Evidence is again insufficient. Now, vitamin D for the PCOS is concerned, again, the evidence is limited. As far as the myoinositol is concerned, again, I just now mentioned that the more data is needed, and before one uses myoinositol left and right in PCOS. As far as the antioxidants for female subfertility is concerned, again, a very low quality evidence is there that it increases the clinical pregnancy rate. And when it comes to live birth rate, again, very low quality evidence is there at present. Women undergoing IVF and ICSI cycle, again, there is no evidence, no benefit that it increases the clinical pregnancy rate and live birth rate. Now, a single antioxidant, according to Cochrane 2015, where a lot of studies have been taken into consideration, no association was seen with the clinical pregnancy rate except the pentoxifylline. Now, as far as pentoxifylline is concerned, in endometriosis, it has no an association that it benefits. More data is needed. So there is a fashion that, expensive combined antioxidants are used, but I will say that this is all industry-driven studies. More data is required. The role of antioxidant disease-wise, I just now mentioned that the PCOD is one condition where you find that there is some evidence that it increases the clinical pregnancy rate. However, heterogeneity was extremely high. While in other conditions like endometriosis, unexplained infertility, tubal infertility, no association was found between antioxidants and clinical pregnancy rate. Now, as far as the oral antioxidant supplementation in ART cycles are concerned, over 28 trials had been taken, taking more than 3,500 women. Again, very low quality evidence was there that neither it was associated with increased pregnancy rate or live birth rate. The Cochrane meta-analysis came by the same group in 2017, and this time they had done 15 trials involving 6,500 women, and the results showed that there was a slight improvement in live birth rate, clinical pregnancy rate, and miscarriage rate. The live birth rate increased from 20% to 26 to 43% in these very many studies. Now, as far as the clinical pregnancy rate was concerned, from 22%, it increased to 27 to 33%, again, very marginal. And as far as the miscarriage rate was concerned, there was hardly any difference was there. As for the adverse effects which are reported with the use of antioxidants are miscarriage, multiple pregnancy, gastrointestinal side effects, ectopic pregnancy, OHSS, and preterm birth, which we cannot say that specifically they are related to antioxidants. Oxidative stress is expected in ART cycles. Endogenous sources, the gametes and the pre-implantation embryo have a potential to generate free radicals, while exogenous sources like in IVF lab, visible light, centrifugation, cryopreservation, both and the culture media, oxygen concentration, the pH, temperature, and in vitro embryo transfer technique, all these generate some amount of free radicals. Now, lately there has been addition of these vitamin E in the media. Vitamin E, when added to cryopreservation media, increased the rates of blastocyst development and embryo protectant, they were found. Vitamin C again in the media was found to, it was added to the media 1 hour before, reduced DNA damage, increased the rates of blastocyst development, and improved sperm progressive motility. Melatonin, when given orally, found to have increased in the number of fertilized embryos. L-carnitine, again, when was added to the culture medium, improved the blastocyst development rate by preventing lipid peroxidations. Coming to a couple of final slides, the antioxidant propaganda is, I feel, is overhyped. The sales have increased steadily since 2009, with sales to infertile women accounting to the largest increase. Most of the RCTs have been funded by the pharmaceutical companies, and meta-analysis of most of the studies show that there is a selective reporting of the benefits and under-reporting of the adverse effects. And most of the RCTs were inconclusive. My final conclusion slide is the combined antioxidants. There is no evidence between antioxidants and clinical pregnancy rate in women with endometriosis, unexplained infertility, and tubal infertility. Insufficient evidence of association between antioxidants and clinical pregnancy rate is there in women with PCOS and women who are undergoing ART cycles like IVF and ICSI. So, as for the male infertility is concerned, combined antioxidant male infertility, they avoid the use of non-evidence-based drugs for a long time. फायदे के बदले नुकसान कर सकते हैं. Antioxidants useful in a mild problem. Antioxidants are useful in mild problem, and antioxidants are not reliable in severe problem. But what is the choice left with ART experts? देना तो पड़ेगा ही. Thank you very much.
Thank you, ma'am. I would like to invite comments from Sir Brigadier Sharma, sir. Starting with you.
Thank you, madam. Excellent talk by madam, and she's covered all the aspects, and she very forthrightly brought out that we are giving it, but what is the actual response going to be is not sure as yet. And also we remember that from the germ cells to form a mature oocyte, it takes almost 200 years or 200 days. So if you have to give it for the improving the quality of oocytes, the minimum of 200 days, and for a sperm, it takes about 70 days. So one has to give that long, then only one can say. Just giving by 1 week, 2 weeks, we will not expect anything. The most important thing is that today this Zomato and Tomato, they are killing the Indian kitchens, and because of that, the natural food which we are taking and which are having all the good properties for good health, we are not taking that. So the most important thing is a change in the lifestyle and telling the infertile couples that they should eat more the home food rather than the outside food, because that will give them all what is needed to have a good quality egg as well as the sperm. And adequate sleep, because melatonin is released in the night, so they should sleep adequately, at least 8 hours. Because of this, surfing the mobile the whole night, the husband wife together and surfing the mobile and not sleeping, not doing anything and not sleeping as well, and that both are not very good for the fertility. So that also we have to tell them. And the normal Indian diet provides you everything, antioxidants and multivitamins and micronutrients. So they should go back to the basics. And in case we need to give the antioxidants in the females, yes, madam has brought out very nicely, the PCOS patients and maybe the elderly or the poor responders with the poor ovarian reserve, they may be benefited to some extent. but still we require a lot of RCTs to confirm that. But in the males, when we are giving it, most of the time we are giving it just to involve the male in the treatment. Because looking at the semen report, if we tell them that you are perfectly all right, the next time, he will go outside and tell the wife, I told you, you are the problem. So just to reduce the pressure on the woman. So I think that is one of the main objective of giving something which is not harmful, but yet keep him also involved to make sure that otherwise, as such, the woman is having the brunt of the infertility. So that is a most important aim as far as I am concerned when I'm giving antioxidants to the males, just to save the woman from this problem.
Thank you, sir, for wonderful comments. Yes, you are very right. Use of mobile at night, melatonin goes away because the light of the backlight of the laptops and the mobiles, they are as good as a bright sunlight. So no melatonin, no release, no sleep, and no repair in the body goes on. And that repair requires antioxidants, which are naturally available from a good diet. So I would just take that yes, antioxidants can be very well sought from the food we eat and the behavior we have. I'll invite expert comments from Dr. Jyoti Bali, if you're there. Dr. Jyoti, ma'am, you're muted. Ma'am, you're muted. Dr.
Dr.
Jyoti
Seema
Agarwal.
Sehgal, Sunita Arora, other people. Comment.
Yeah.
Anybody.
Yeah, Dr. Seema Sehgal, your comment. Dr. Sunita, are you there?
Yes, I'm there.
Yeah. So
So,
your comment for antioxidants and your
so
personal.
ma'am has so nicely presented all the evidences and all, which clearly say that there is not, a
It
clear
goes back to
benefit
square
from.
one. It goes
Yeah.
back to square one. Yeah.
So, I think मेरे को ऐसा लगता है personally, if the patient is in waiting time, because these drugs like Ultra Q300 and all ना, ये जो CoQ10 है, there are so many studies which say that they act at mitochondrial levels. So when I'm not getting anything, like 42-year-old, 41-year-old, they are not willing for anything, no follicles also. So then I tell them, take this for 3 months and then come back, let me see. So otherwise, as ma'am said, I don't think there is a clear-cut benefit of giving this. We are getting, जहाँ पे जैसा prediction होता है, PCO patient है, multiple follicles हैं, they usually get good number, and जहाँ कम दिखता है, वहाँ वैसा ही रहता है. So only, you can say that just to those waiting time period, patients say that, ma'am, I don't want to do anything for next 3 months. I want to come back in 3-4 months. So then I put them, and it is empirical only. There is no clear evidence.
The patient's anxiety
Yeah,
is really,
sometimes they
that's
say,
the biggest
and
thing. Yeah. They are,
it is
what
very
you said
difficult to tell them that, other doctor, he gave me so many things, she gave me so many medicines, and you're not giving anything. So I think, yeah, you're right. It is just to kill the anxiety that you are getting
was
some
anxiety.
supplements.
Yeah.
I
But
think
I don't
nowadays,
know, because there are so many papers, especially on CoQ10, which see
300.
clearly that mitochondrial level they are acting, they are anti-aging in a way, and they prevent Alzheimer's also, and so many things. So really don't know, but yes, doesn't look like that they give you any benefit.
but actually, patients they feel very happy taking something. They feel
Yes.
they are taking something very great, and nowadays the trend has changed. People don't mind getting investigations done, and same way they want too many things.
Spend money.
दवाई
Spend
नहीं
money
हाँ,
also.
ताकत की दवाई नहीं देखी तो sort of thing these drugs are there which
डॉक्टर की फीस नहीं देना, बाकी सब कुछ लेना.
हाँ,
बाकी
बिल्कुल.
सब कुछ करना है.
डॉक्टर जी तो एक बार देके सर वो दोबारा देना ही नहीं चाहते, दे तो दी ना. That's more than enough.
मैम दूसरी बार तो बात ही तो करी है ना आपने, फिर भी
दूसरी बार बात ही तो करी है. Exactly.
रिपोर्ट ही तो दिखाई थी.
Report.
What choice you have, you don't have any choice. देना तो पड़ेगा ही.
Exactly, ma'am. And let them act as a placebo, doesn't matter.
So that's
Yes.
If we get positive results, nothing.
Anybody wants to make any comment? Anybody wants to make any comment?
I just
Dr.
want to ask
Yes.
one question, ma'am.
Yes,
Neha
Dr.
wants
Khanna.
to.
Yeah, if endometrium is thin during FET, HRT cycles, what to do?
Endometrium thin, you are. Ma'am, you're muted. Ma'am, you're muted.
मैडम वो तो प्रॉब्लम ही अलग है, उससे
Problem अलग है.
एंटीऑक्सीडेंट से क्या पता चलेगा.
नहीं वो तो साइकिल कैंसिल करोगे ना थिन एंडोमेट्रियम में.
Anyway, उसका प्रॉपर ट्रीटमेंट है, नेहा अभी नहीं लगाएंगे उसको क्वेश्चन को.
I just want to add one this thing, food for thought for everyone. This L-arginine we are giving, basically they open up the blood vessels. So hoping that more of your estradiol will reach the endometrium, and the chances of endometrial growth will be there. So there is one Himract gel, which is basically L-arginine gel, which is to be given to the women, and also to increase the libido. They apply over the clitoris or the private area, and for the male also, those who have erection problem.
So
So the
what's
same I tried, because this is water soluble gel. The same I tried, to give it vaginally to improve the endometrium, and it did work when everything else was not working. So I think wherever you have problem, you all can use it, and let us put together the data whether this, because this goes directly, rather, because when we give orally, maybe the lesser concentration is going to the uterus, and when we give it vaginally, it helps. So
So what's
this
the name?
Name, sir.
Himract, madam.
Himract.
There is one company called Himros, which makes this L-arginine gel to increase the libido in the females and the erection issues in the male. So I tried this vaginally; it has worked. But unless we have many people using it and giving us data together, so next time we can discuss, or maybe after some time, in the bad cases where the endometrium is not growing at all, and there's no addition. It's not a case of Asherman. Otherwise, unexplained thin endometrium. So we can try this. I mean, I have tried it. It has worked. So this thought came because Dr. Neha had asked the question about thin endometrium. So I thought I'd share my experience on this particular molecule.
Thank you.
So my request is that,
Thank you, sir.
where the patient has got very few eggs, I think, there should be a common protocol which, we should use and pool up the data. I think that's a high time has come for the same. So I think it had been a great session, Dr. Arora, and hopefully that, my presentation also liked by other people.
Very nice, ma'am. Thank
Very
you, ma'am.
nice.
Thank you so much. Thank you, sir.
Thank you, thank you, thank
Dr.
you,
Vandana.
friends. Thank you, sir. Thank you, ma'am. Wishing you all a very good evening, and this has been an excellent program and very thorough.
Thank you.
Under the guidance of two experts, it's always been very blessed.
Thank you. Thank you.
Thank you, ma'am.